I want to welcome everybody to the Board of Health's meeting. First of all, we'll introduce ourselves. I'm Kay Leach, and I'm serving as the current chair for the Board of Health. And I'm going to ask all the board members if they'll introduce themselves. Dr. Hageman, you're first.
Hi, my name is George Hageman. I'm a retiree from IU's biology department and a microbiologist. I joined the board a good long time ago, and it's been a good experience.
Okay, and next is Mark Norrell.
I'm Mark, and I teach healthcare management and policy at the O'Neill School at IU.
And Dr. Pritchard.
Hi, I'm Steve Pritchard. I'm a retired dentist retired from clinical practice anyway. And I've been on the board for, I don't know if it's been 20 years, but sometime. So thank you.
And Dr. Wren.
I'm Robert Wren, a retired physician, obstetrics and gynecology. Been on the board 4 or 5 years, enjoy helping the community. I do some teaching with the medical school.
And I messed up and didn't go in alphabetical order, but Dr. Talukian, you're next.
Carol Talukian, I'm a retired pediatrician, and I've been on the board not quite as long as George.
Okay, and our health department administrator, Penny.
Penny Cottle, department administrator, and since 2008, but here a lot longer.
And Dr. Sharp, our health officer.
Dr. Tom Sharp, I've been the health officer for more than 40 years. And Dr. Pritchard and I played tennis last night. He played really well and let me rest, and I appreciate that.
Yeah, well, definition of well, maybe. But thank you.
Your mask, correct?
Unfortunately, yes. We were practically the only ones in the tennis pavilion, but yes, we had to wear masks. And we've all had shots, by the way.
And our legal representative that helps us with the board, Margie Rice. Margie, are you, there you are.
Yep, here I am. Hello, I'm Margie Rice. I'm one of the Monroe County attorneys, and I'm happily assigned to the health department.
We're glad to have you.
And we appreciate it. First on the agenda, I'd like to ask if there's anybody from the public that would like to come before the board to make us aware of an issue. If so, would you please raise your hand on your screen and let our technical people know you wish to speak. Michelle, do you see anybody out there?
There are no hands raised.
I don't think so. Okay. Next, we'll look at the minutes. These are the minutes for March the 11th. Boy, time flies by, doesn't it? Has everybody had a chance to look at the minutes? Any corrections?
Well, I think you had some corrections, correct?
Earlier, when Penny sent them out to me, I came up with a couple of corrections, and those have been made.
Okay.
So are there any other corrections?
I would move that we accept the amended minutes as presented just prior to the meeting.
I'll second that.
Second. And Kay, could you turn up your volume just a little bit? My feeble ears are having problems hearing you.
Yeah, you're a little hard to hear tonight.
Maybe just need a bit closer.
Oh, I was on Zoom earlier this morning and I kept getting messages that something was wrong with our audio. Is that better?
Yeah, when you're closer to the computer, it's a little better.
Okay, I'll move up. Okay, we have a motion and we have a second. Let's take a vote. Hageman?
Yes.
Norrell?
Yes.
Pritchard?
Yes.
Talukian?
Yes.
Wren?
Yes.
And I also vote yes, so the minutes stand approved as the changes that were made prior to the meeting. Okay, next is public health reports. Penny, You're first with administration.
Sure, just a few things to add to kind of the general updates in your packet. Our assistant registrar and vital records started today. Megan Winters joined us and has completed her first full day of employment in that position. So we're glad to invite her and have her join. We did get a note from Sally Peltro Wheeler from Collaborative Training Network. Just a note, I will tell you that she was grateful to have worked with us through the pandemic. She said our conversations were bright spots in challenging year of uncertainty, and she wanted to send along her thanks and gratitude to the staff and the Board of Health. So just wanted to share that with you. Also, a couple of renewals for our grants. We've renewed our naloxone grant, which provides naloxone. It's not a monetary award. It provides naloxone so that we can distribute that in the community. We are renewing our sexually transmitted disease grant that funds our disease intervention specialists. And futures grants, it gets a variety of them, Title 10, TANF, Title 5, but we just got that renewed. So we're happy to report those things. I am working on the job descriptions for the 2 new manager positions that you had talked about last year, and that council actually agreed to move forward. And those, just a general kind of reminder discussion is on the PAC agenda, which is a subcommittee of the council for April. That normally would have been this afternoon, and that was postponed. And the only other thing I would say is just start thinking about that 2022 budget and the things that we may want to think about putting in there. So more to talk about that probably in May as we come into budget season, but just to mention it now so that you're kind of thinking from a board perspective where you think based on priorities and what we've talked about, what you might want to do. We continue to do the vaccine clinics. We are probably going to add a day or some times at the convention center with a little bit extra vaccine that we're receiving. IU has opened our site at Assembly Hall, plus the university is also now doing special clinics for their students. So there is a lot going on at IU. We're still very, very grateful for their input, and we are still working on some additional outreach. I think I mentioned this to you. We've been doing the homebound, and we've done, in conjunction with the hospital, our shelters. So we're excited about that and excited to expand that. And I think that that is all that I have that wasn't mentioned previously.
Public health clinic updates. Is that Amy?
I think it's Jama is here for Amy.
Okay.
Yeah, this is Jama.
Oh, hi, Jama.
Hi. I'm the charge nurse over with the Monroe County Public Health Clinic. And this past quarter, we have mostly been busy with COVID vaccination clinics. I'm pretty much leading up the efforts at the Convention Center Clinic on the days that we're open there. As I think you've all got the report with our quarterly numbers. Some of that is still needing to be updated. For example, when it had 0 cases of latent TB infection, I think it's more accurate to say it's less than 5 for the quarter. We're also continuing to do communicable disease investigations. And we've also started a homebound Hoosiers program to get COVID vaccinations to the homebound people who can't get out to COVID vaccine clinics themselves. And so we've partnered with city and county fire departments to train their EMTs and paramedics to do vaccinations. And then on a weekly basis, we've been sending them out to do about 20 a week in the homes. And that's been going very well. It's been a very successful program. People seem to be very appreciative of that. And we're also doing a lot of, starting up a lot of outreach clinics to get COVID vaccinations to the underserved population. So we've been to several shelters already and have many others planned in the upcoming months and weeks. To take care of our schools, this is usually the time of year that we would go into schools and do vaccinations. Since we're not able to do that this year, we're going to open up some special times at the Monroe County Public Health Clinic. So that that's going to start on Mondays in May. We're going to open up, have some later hours for people to be able to have access to appointments at more convenient times that are after school and maybe after work. So that will start Mondays in May. And we're going to also advertise that through the schools, specifically trying to target those adolescents that need the 6th grade requirement shots before they go in. So we try and hit them at the 5th grade age. And then, so we'll probably target 5th and 6th graders, knowing that a lot of them didn't get caught up this past year due to COVID. We also have confirmation that we have secured our immunization grant for fiscal year 2022. So that's good news. And I think that's about all I have. Does anyone have questions that I might be able to answer?
Thank you, Jama.
Thank you.
Next on our agenda is a presentation by Tandem. Who's doing that? I think Julie, is that correct?
Yes, I'm Julie Duhan. I'm going to go ahead and try and share my screen. If you're able to enable that for me.
Give me one moment, please.
And while that's getting enabled, I'll just introduce myself. I'm Julie Duhan. I'm a Bloomington native, and I'm also a co-founder of Tandem, or Tandem Community Birth Center and Postpartum House. We're a new nonprofit based in Bloomington, and we've just recently received our 501c3 status as well. Okay.
Go ahead and share.
And let me put this in presentation mode. Okay, can you see the slide? That says catch babies, help families, build communities?
Yes.
Yes.
Great. So these are our co-founders. Our board is now up to 4 members, and we'll be growing to a 9-member board as we develop organizationally and become more of a matured organization. So my co-founder, Hattie, is a professional midwife. My background is in clinical informatics, and my most recent professional role was back in Palo Alto, California, where I worked as the IT security operations manager for Stanford Healthcare. So what are we trying to do? We want to improve maternal outcomes. We want to increase options for care. We hear over and over within the community here that although there are excellent options for obstetric care, for birth, there aren't the options that everyone wants. We have a diverse community with diverse needs, diverse backgrounds, and there are legitimate reasons why the existing options aren't what some people would choose for themselves. And I'm sure in your roles within the health department, many of you may already know that Indiana has the 3rd highest maternal mortality rate in the country. Now that's CDC data that goes, I think, until 2018, and there's more recent data coming. But regardless, we've consistently been ranking in the worst, the top 5. So we want to focus on providing excellent, high quality, and evidence-based care. So what are the components?
Are those statistics statewide or countywide? Do you know how Monroe County fares in that statistic?
So Indiana is the 3rd highest as a state level statistic. I have tried to find county level data and failed. I've gone on a wild goose chase with the state, but the data is just not broken down by county, and it's not collected at the county level. It's done as far as I've been able to tell, it's a retroactive analysis of patient charts. After cause of death is determined. If someone dies of a heart attack, it's just a heart attack. And then later in this much broader analysis that's done for maternal mortality rankings, someone may say, oh, this person actually gave birth, you know, a month prior to having that heart attack. And I think that's another important component. A lot of people think maternal mortality means they die in the process of actually delivering a baby. And really, many more maternal mortality deaths happen in the weeks and months following delivery. So it's very hard to, I actually have an intern from IU assigned right now to trying to get county level data. Another reason it's challenging is just that the numbers are relatively small, right? It's not one person every 100 who's dying, you know, it's 1 in thousands or 10 in thousands. And so it's, you know, of 2,000 people giving birth in a county, or sometimes fewer in our own county, you know, there may not be anyone who dies this year or anyone who dies next year. And so it's hard to get an accurate statistic at a county level as well. You'd have to really look across multiple years to fully understand it for one county because it's such a rare occurrence. And I think we do better to track not just maternal mortality, but also these near misses where people come very close or have, you know, they end up with outcomes, with negative outcomes, whether that's an unplanned hysterectomy or that's done to save their life postpartum, or, you know, other things, including mental health outcomes. Maybe they have to check into a mental health hospital due to severe postpartum depression. You know, those things. I'd like to see us tracking all of those that wouldn't be captured in straight up maternal mortality rates. So. Please do continue interrupting me with questions. I can't see your faces while I have it in the presentation slides right now. So please speak up if you want to jump in with a question. Thank you for that. So there are 3 sort of core components to Tandem. The first one that we'll be introducing is community care. So this summer we'll be offering childbirth education, lactation education, postpartum planning. So we're also offering a few courses through the Ivy Tech Center for Lifelong Learning, such as the history of midwifery, sort of introduction to midwifery 101. We hope to follow our community care programming, which will primarily be offered online, with the actual launch of our medical clinic. So we would like to open that in the spring of 2022. We'll be working towards having a licensed birth center. So this will be staffed by certified nurse midwives. My co-founder Hattie is currently back in nursing school, working on converting her professional midwifery license to a nursing license so that she can actually practice in her birth center. One of the things we hope to offer that's not currently offered in Bloomington is water birth, to have birth tubs in our birthing suites. And then the postpartum house. This is perhaps the most unique aspect of Tandem. We believe this is the first of its kind in the state, and likely the first of its kind really in the country. There are some things that look a little bit like it we know in California and New York, but not quite what we're looking at. So if you think of this as sort of like a hotel, sort of like a short-term stay group home setting, the idea is that people in that 4th trimester, so they could check out of the hospital, check out of the birth center, come straight from a home birth and check into the postpartum house, or it might be they're 1 month, 2 months postpartum and they need some help. Maybe their partner has gone back to work. Maybe they're just the aggregation of all their sleep exhaustion, trouble with feeding, dealing with siblings, whatever it is, they just need some space, some time, and some help. And so they can check into our postpartum house, and it will be staffed 24/7 by postpartum doulas, and they will be nourished, hydrated. Someone will be there who can help them with positioning the baby for feeding, who can hold the baby while they take a shower, while they take a nap, help them in the middle of the night with middle of the night diaper changes or other care issues, just provide them connection and support. And then we will, during the daytime, we'll have services for any of those overnight guests as well as daytime guests. So the daytime aspect of this looks a little bit more like if any of you are familiar with BABS, Bloomington Area Birth Services, that closed about 5 years ago. They served about over 600 families in our community every year with, prenatal education and groups, parenting groups for young families, prenatal yoga, lactation services. So they were serving folks just during the day. People could just drop in and see what services were available and, ask questions, look up what doulas are available in our community, that kind of thing. So we plan to have similar services to what BABS would have during the day, but also we want to bring in specialists to consult with both our overnight guests and our daytime guests in the postpartum realm. So mental health expert who's going to come in and give a talk on postpartum mood and anxiety disorders. We're going to have a pelvic floor physical therapist come in and talk about pelvic floor health in your postpartum recovery and what's normal, what that people might be experiencing, get people asking questions about what they're feeling. I'd never heard about prolapse until I had it, right? And then also, lactation consultants and other specialists, the whole spectrum of what it takes to really heal postpartum, and bringing those to one central place where people can take advantage of those services. So what's been going on? So when we started planning in the fall of 2019, Hattie and I had been talking about Bloomington needing a birth center for a long time. We both recently bloomeranged back to town from various places, me from California and Hattie from Florida, where she received nationally accredited midwifery education and was practicing in birth centers there. And she had enrolled at Ivy Tech and saw this pitch competition. And we said, you know what, let's do it. So we did it, we won it. We used the $500 winnings to incorporate, and we started doing business development. And of course the pandemic hit. So we did business development twice. We developed our business plan once for, this pandemic, it's not going to last long. And then once for, nope, it's going to stick around for a long time. We better rework this plan. We submitted our 501c3 status. We have currently 6 interns from IU, unpaid interns doing work for us in a variety of realms. We are expanding our social media presence. We are launching massive fundraising efforts. We've negotiated with the city for zoning, and we're currently applying for grants every day. I feel like we're putting in applications or finding another one we should be applying for. And we have recruited a physician. We haven't publicized the physician aspect. So we require a physician to collaborate with our nurse midwives. They have to have somebody who's granting them prescriptive authority. And we also need a physician to serve as in the staffing physician role as defined by Indiana state licensing for birthing centers. And so we have just recruited this physician. We're very excited, but we're still finalizing our contract with him. So we're not announcing all the details on that yet, but that's coming very soon. We just want to have a legal agreement in place so we know that everything is, all the I's are dotted and T's are crossed, and we have to have him, otherwise we can't operate. So that's a very exciting development, but we'll give all the details.
Julie, I have a question, please, ma'am.
Yeah.
This is really exciting, and I'm looking at this, and clearly you've got sort of a very detailed, well thought out thing, and I was going to sort of ask about the physician component and the collaborative practice agreement, but is this a physician that is already here in Bloomington, or is this going to be somebody who's recruited new, and will perhaps that newly recruited physician move to town and practice in Bloomington, and would that be an obstetrician gynecologist?
So he is an OBGYN. He is not based in Bloomington. And initially he will be doing remote work for us. We have not lost hope of carefully luring him to Bloomington. He is licensed to practice in Indiana, but he is not here right now. I will say we've also been talking a lot with HealthNet, formerly Volunteers in Medicine. We There are some birth centers that have agreements with federally qualified health centers like HealthNet in the country, not in Indiana specifically. And so before we found this physician, we had been talking to them about somehow negotiating an agreement to essentially share any OB that they might bring to town if they expand into OB services, which I believe is their intent coming up here in the next year or two, if they can expand their facilities. So we hope very much to be collaborating with HealthNet as they expand. We don't know what all of the details of that might look like, but for now, it's not a physician who will be in Bloomington, though we are trying. He's got a young family, and so we understand that the wining and dining has to be done to his wife. So we're planning to do anything and everything we can to lure them here. Yeah, great question. So yeah, so this is where we are. We are still adding to our board, obviously continuing fundraising. We have been looking at locations and we're hoping to get one this summer. What are our biggest barriers? Well, the first was the collaborating physician barrier, and we have a doctor. So yes, we have an OBGYN. We feel really good that barrier seems to be surmounted for us. Zoning was a challenge. The city codes wanted us to be zoned as a hospital because there is no code for a birth center, and because babies are born at 2 a.m, that put us into the hospital zoning code. But because we've explained that our stays as within the birth center, so not the postpartum house, which is not providing medical care, but rather supportive services, the birth center itself will not exceed 24-hour stays. And so because of that, so our postpartum care from the midwives will be done in the client's home. So you come into the birth center, you give birth, 3 to 5 hours postpartum, you're discharged to home, and then the midwife comes to your house the next day to check in on mom and baby, and then a few days later as well. And so because we explained that our stays won't exceed 24 hours, the city of Bloomington has agreed to zone us as a medical clinic, which gives us a lot more options in terms of where we can be located. Our most important piece of that is that we have to be near the hospital. If we know that emergent transfers from birth centers are extremely rare, but in the event that we have one, we want to be very close. And so we're definitely looking within a tight radius around the new Bloomington Hospital, or new IU Health Bloomington Hospital. We've also looked at some locations that are just outside of city limits in the county, but we're running into county zoning issues. They also want to zone us as a hospital, and we've not yet been able to convince them we're not a hospital. So if we really have to, we'll try and do that. But right now we're focusing our search on the city because that's already been taken care of. And then the last is just fundraising. We had all these brilliant fundraisers planned involving, trivia nights on, with a birth theme or whatever. But we had a lot of fun fundraisers we had planned for this, and there's just it's just more of a challenge, but we are very confident that we can do this. There was a petition that circulated in Bloomington. Just a moment. So there was a petition that circulated in Bloomington about 5 years ago after the last births at Bloomington Hospital. There were a few certified nurse midwives who were catching at Bloomington Hospital, catching babies, and the last births occurred, and there haven't been in the last 5 years any births with nurse midwives attending. And so this petition circled shortly after that stopped, and it was addressed to IU Health and the obstetric community here in town saying, we want midwives, we want midwifery options, we want a birth center. this is our community. This is what we want. And more than 1,000 people signed that petition. So we see ourselves as responding to that petition. So we know that the support is there. We just have to be a little more creative in finding it. And like I said, we're seeking grants right now that some of them we feel very hopeful about. So good news, there's demand. We do have an investor who's willing to invest for a return on investment. We'd rather not have loans, so we're gonna do our grants and other fundraising first. We really think that our birth center was needed before COVID, and now it's just been highlighted how important it is. We've had a steady stream of people calling our Tandem phone number to say, hey, will you be open in about 6 or 7 months? And we're hearing a lot from people saying, I'm scared to give birth in a hospital. I don't want to go to a hospital. I'm not sick. There are sick people at the hospital. I don't want to go there. Where can I go that's safe? And so we really feel it's important to have this option in Bloomington. So I did miss a slide. So I wanted to share with you some of our values as we go into building this birth center. The uterus is important, but there's more than just the uterus that's important in pregnancy. These families, whether that's one person with their baby becoming a family, or a couple, or a family that already has 10 kids, there's a lot more going on than just growing that baby. It's an immense physical change. It's an immense emotional change. The family dynamics are huge. So we want to really see the whole family for their care. We want to offer care to everyone. We will be accepting Medicaid out of the gate, as well as self-pay clients. And then as we grow, we'll accept insurance. We'll negotiate contracts one at a time and add those with insurance companies as we see where our clients tend to be insured, what the most common options are. But we'll start with self-pay and Medicaid, and also offer sliding scales. We are very focused on equity and inclusion. We would like to offer, we're hoping to hire care providers that represent people from different backgrounds in our community, so that people can find providers that they feel will better understand their own backgrounds. And we're reaching out to various organizations to have training for our board and volunteers and employees on equity and inclusion and anti-racism. We are extremely, I think I mentioned at the beginning, my background's in healthcare informatics originally. I love data. And so we've been working collaboratively with Professor James Clausen at IU, who is a healthcare informaticist specifically focused on maternal healthcare. And we are hoping, once we get a physical location, he's going to have from his core research group of undergrad and graduate students, to have students assigned to us to track data for our birth center from, like, as a case study from opening, from day one, and make sure that we have just the most robust data collection and metadata, so that we can answer any question you have. Tell me your data on lacerations. I want to know breastfeeding success rates. I want to know your transfer rates to the hospital. We're going to have all of that. We're going to share it as transparently as we can, obviously, while still respecting patient privacy and following HIPAA laws. And then making sure that our community understands that care doesn't end once there's a baby. Postpartum care is 100% essential. And, already we felt like there is a crisis in our country in terms of the isolation of becoming a new parent. And, that's only doubled, quadrupled. It's just grown exponentially with the pandemic. And we want to really focus in on that and provide a supportive village for our families and in our community. So although this is Bloomington centric, we see this as a focal community effort for Monroe County and all surrounding counties. There is nowhere to give birth in several of our surrounding counties. You know, there aren't labor and delivery units. There's a shortage of providers. Even in Monroe County, we're listed as having a shortage of OBGYN providers and so that is Tandem. Thank you so much for letting me present. Are there any other questions?
Good luck.
Thank you. And I'll just put our website here so you have the link in the chat if anyone wants to look at that. We just wanted to present to you because, you know, you're the county health department, but if you have any questions, concerns, if there's anything we can answer for you, we are more than happy to do that. We want to partner with our local organizations to best support our community.
We can.
Much for coming to talk with us tonight.
Thank you. Okay, I'm gonna drop off all the way. Thank you, guys.
Thanks, Julie.
Okay, next is old continuing business, renewal of Security Pro contract. Penny?
Yes, so as you all are well aware of, and we talked about at the last meeting, we've had Security Pro 24/7 helping our department in terms of following up with businesses and compliance. So the compliance officers go out, we communicate each week, daily, whatever is necessary in terms of what kind of complaints we've received, where they might want to go that maybe wasn't already just part of the routine. So they try to hit our retail food establishments and assist them in dealing with patrons, but also other businesses, retail businesses as well. So we're very, very glad to have them have that assistance with the continuation with our public health orders. We feel like it's still necessary to keep that contract going. At the last meeting, you all supported that. In general, the Board of Commissioners has approved the extension of this contract, and it's listed through July 1. And then if we don't need it before that, either party can terminate the contract early, but that prevents us from having to come back every single month. So it gives us a little reprieve that way. And so we're just asking officially for the board to approve this, ratify it, and take a vote on it.
Thank you.
I move that we accept the contract that you presented to us.
I'll second that.
And we have a second. Okay, let's vote. Hegeman? George? George, can you hear me?
Yes.
Okay. All right. You're voting yes?
I think you meant yes.
Yes. Okay.
I said yes. I'm having trouble unmuting.
Yes, he can hear you, and I think he means yes.
Narelle?
Yes.
Pritchard?
Yes.
Tolukian?
Yes.
Wren?
Yes.
And I vote yes. Motion's approved. Okay, next is the COVID-19 regulation discussion and review. Penny, do you want to take that, or does Margie?
I can take it. And again, we have two. I would like to start with the residential communal regulations. I know that we have some people on the call on our meeting tonight who are interested in that. So I'd like to start with that. And then I'll start, and then Margie can kind of chime in with anything that I miss or additional information. So, and Michelle, this one probably doesn't need to be posted, but the other one we might want to go through. This would take effect essentially today and be in effect until further rescinded. When we talked before, we had talked about occupancy for houses, and we are looking to make a change for fall. So we would ask that you consider that houses may plan for up to 90% occupancy if all members are fully vaccinated, and isolation and quarantine space is included in their plans, and that space would be within their house, so that they would have to have at least at a minimum, some minimum space for quarantine and isolation. That's why they would only go up to 90%. We know that some houses have this year have secured other locations for some of that isolation and quarantine, or if they have more than one, something like that. And that would certainly be acceptable, but every house should have something within their house that would meet those needs. So with the onset of vaccinations, the universities across the state starting to vaccinate their students, we felt like that was a change worth actually bringing to you to consider. And I don't know if you want to look at these individually, or there are really two changes within this. Do you want to discuss them separately?
I think separately is good.
Okay. So,
do you have any concept of how you're going to document that they're 100% vaccinated?
well, that's a good question. I would think we can do this one as an exemption. It can be that they've got to provide that vaccination record so that we know that everybody who is on their live-in roster is in fact vaccinated.
I mean, because you can say, yeah, I'm vaccinated, but that doesn't mean you really are.
Absolutely.
And the paper cards are pretty easy to duplicate.
Well, those records will be insured. One of the advantages to them being vaccinated before they go home, or having the ability to be vaccinated before they go home, is we will have easy access to those records as well.
So you'll confirm it's not just saying, yeah, I'm vaccinated and here's my card that looks a lot like the other ones, but it's actual documentation from the clinics that they're vaccinated.
What if we have members that do choose not to be vaccinated?
And Margie can chime in on this. I would say that if you're requiring all members to be vaccinated or all residents to be vaccinated, then if they have someone who declines that, then that would be between the house, part of their lease, however they want to look at that. What you're really looking at is what are you okay allowing, and how they might deal with that would be up to them.
Yeah, I would rather see it. I don't have any problem with it if they actually really are 100% vaccinated, expanding to 90%. But I would like to see it as that they need to apply for an exemption from the 75% rule as opposed to making it a standard.
I agree with that.
Anybody else?
No one else is saying anything.
Carol, I agree with that. I think that's a good thought.
So does someone want to make
a motion? So Carol, is that a motion?
Sure, that's a motion. I move that we allow 90% occupancy in the fall for fraternities and sororities that are houses, actually they're not fraternities and sororities, that are have documented 100% vaccination via special request to the health department. Did that make sense?
Yes.
Oh, good.
I'll second that.
Okay, we have a motion and a second. Let's vote on it.
Can I ask a question before we vote?
Sure.
I was under the impression that, we couldn't directly regulate houses in this way. So does this just fall under generic congregate living, or can we do that?
Sounds like a Margie question.
Yeah, that's a Margie question. For
Archie,
sure.
can you answer that?
Well, I mean, the way you're doing these regulations in general is under the Indiana Code provisions that allow boards of health to regulate if they think there are conditions that may cause the transmission of disease. So, you know, that's the general authority we're operating under. And I guess, Mark, is your question whether are you think the board's, you know, going a little too far in terms of regulation, or?
No, I don't.
Yeah.
I have no, I think that's sound policy. I just am wondering about whether we have authority to sort of target fraternity and sorority houses as opposed to some sort of generic congregate, you know, any place that, you know, does this apply to nursing homes that have?
Yeah. That's a good question. And there's a footnote that we've had in these regulations saying that, let me find it again. It says the public health regulation is not intended to address state-owned or managed property, correctional centers, transient or homeless shelters, domestic violence shelters, long-term health care facilities, or group homes for developmentally disabled persons, which may be licensed and or subject to other regulatory agencies or inspections. So
right. So they have separate regulatory bodies above them.
Yeah.
Okay.
Yeah.
Thanks.
And yeah, no, and you know, the reason why, you know, communal living regulations caught the attention of the health department is because numbers were pretty high early on, and the possibility of transmission of disease like COVID was really high in that setting. And so, you know, it's not, and I think that, you know, I've had this question from parents of Greek students or advocates for Greek organizations saying, hey, you're picking on these organizations. And it's like, you know, it's just a nature of the way these organizations are built. I mean, like physically built, where huge numbers of people are living under one roof, that makes it, you know, just, you know, the ripe for the transmission of COVID. So it's not because they're Greek organizations, it's because of the way they're structured that they get the attention of the health department, and rightly so, because you have to be concerned with the conditions which may cause the transmission of disease. That's how the Indiana Code's written. It's not organizations that are in fact, you know, necessarily you have to prove that they are in fact causing the transmission of disease. It says those which may cause the transmission of disease. And I think we know from having 100 people under one roof with, you know, sharing bathrooms and kitchens and all that kind of stuff, that it's just COVID is easily transmitted. So that's why they get different attention than other places, and because they're not licensed by anybody else.
Good. Okay.
Yeah, they're not all Greek organizations either. There's at least two that aren't Greek organizations.
Yeah, that's true. Yeah.
And it's also it's done in cooperation with IU health officials who are, you know, doing all the COVID stuff with the university, we've done this based on recommendations that come from them.
Yeah. And also I'd like to just remind people that, you know, this sort of health law is some of the oldest law, again, I've said this before, in the United States, going back to when we had colonies and no big federal government. It fell on local and state government to keep citizens safe from, you know, yellow fever, malaria, with things coming in on ships. So for anybody out there who wants to say that the Monroe County Health Department is violating somebody's constitutional rights, I would suggest that they do a little homework, and they will find that that these rights that they think are being violated have been limited for hundreds of years by local health regulators.
And I was just going to say, I know that we do have an IU representative here. I don't know if they have anything they want to add. And then you may get public comment on this as well. I'm not sure.
Leslie, you're from IU. Would you like to add anything?
Sure. I mean, I think I can just be brief. I would say that what we've seen in terms of our data with the houses has been pretty accurate, and they're great for brotherhood, sisterhood, but have seen high rates of COVID infection across campus, and disproportionate, I would say, to to the population. And so for us, the safe living environment is a priority for our students as well as for the community. In terms of the capacity pieces, I know that, we would like to see as many students and folks and community members get as vaccinated as possible. And so I think that what you suggested is reasonable and in line with some of our efforts as well. And I think the special request and exemption process, obviously it's up to the Board of Health, but I think that makes sense in terms of, I think if we see increase in vaccination rates among the houses, then hopefully, capacity could go up in terms of the safer living environment among the residents. I think the one thing that we'll continue to work with the house student organizations on is reminding them that there needs to be a plan for if there's something unexpected that comes up pertaining to COVID or another pandemic, that they always need to adjust for capacity reasons if needed for the health and safety of the residents.
Thank you. Does anyone from the public want to come in on this issue?
We do have one question that has come up, and that's what if you have someone who can't be, we know that there are very few reasons for someone not to be able to take the vaccine, but there are sometimes even religious reasons that vaccinations are exempt. Would you consider, or would that just be a part of the exemption process for us to review why somebody might not be vaccinated, or is it 100% period?
Okay, we had a motion made and we had a second. Margie, your light's on. Are you going to say something?
Yeah, no, I would just encourage the board to address Penny's point is if there is somebody for, because of an accommodation, cannot get the vaccine, that's something that we would want to talk through and look at, because there may in fact be a situation where it's medically, somebody's unable to get the vaccine. So I would encourage us, if and when that limited circumstance comes up, for us to give that some serious thought.
Well,
I don't have any issues with true medical reasons. I have trouble with religious and philosophical reasons. Although, I think that's something that the health department can address on an individual basis and use their best judgment.
Yeah.
There are very, very few medical reasons why people can't get the COVID vaccine.
Yeah, I agree. I think we should move ahead with the motion with the understanding that as the exemptions come up, well, then we can discuss those. But keeping in mind that there's no guarantee that exemption will be granted. That has to be understood from the language of the motion, is that we're requiring 90% to get 90% capacity. You have to show 100% vaccination, unless you apply for an exemption, and then there's not a guarantee that the exemption will be granted.
I think it's also important to remember, as with all things COVID, things change on a regular basis. So just because we're saying that that's our plan for the fall doesn't mean that if things change with COVID, that this may also change. I think we just have to remember that every time we do something like this.
It is novel.
It's all right. It's why it's called novel virus.
Right.
I do see a hand up out there, and Nancy Russell, do you have your hand up?
No, my hand isn't up, but I very much appreciate this conversation and the potential that you are presenting for us.
Thank you. Okay, we have a motion and we have a second. Are we ready to vote? Okay, George?
Yes.
Mark?
Aye.
Steve?
Yes.
Carol?
Yes.
Bob?
Yes.
And I vote yes. So the motion does carry. Okay.
Okay.
Go ahead, Penny.
All right, the other request, and this just took longer. We had talked at the last meeting about guest policies and gathering sizes, and we did meet with IU. We had several different discussions about it, and I think we finally came to some language that makes sense for us, that we feel works. And so it would read, and this is with the gathering sizes and guest policies, that for the purpose of these regulations, the facility is defined as any and all indoor structures, all covered porches, patios, and appurtenances. That is hard for me to say. Provided a facility has not been placed in yellow or red status by Dr. Sharp or the department for any reason. And that is part of the sort of metrics we've worked with IU to develop. So the yellow kind of puts a house on alert that and gives a few restrictions, but doesn't actually quarantine the whole house. Red status does. So that's kind of what we're referring to there. Non-essential guests may be allowed outside on the lawn or non-covered and non-fenced areas of the property, which are visible from the street, provided the total number of persons, including guests and residents, gathered at any one time does not exceed 15 people. All persons shall follow regulations related to wearing masks or face coverings and follow physical distancing guidelines when gathered with other persons. At no point in time are any non-essential guests allowed inside the facility, and facilities must maintain guest logs as stated above for guests visiting on the lawn or in non-covered or non-fenced areas as mentioned above. So it does allow for some outdoor guests. It does limit the number of people who may gather, and it puts restrictions on when they may gather. So if they're in yellow, that yellow or red status, they're not supposed to be having any events or anything like that anyway. So it would fall in line with that. So that is our recommendation.
And keep in mind the 15 is because that's what the city says they want.
I do have a question about how things are going. And I don't keep track of this, but I do get copied on the emails you send out. So I've seen to notice there's been a few more yellows and maybe a red lately, more than there had been like in the last month or so. Is that my imagination or is that really true?
No, and Leslie always probably, because she very intimately works with these houses all the time, but we have had an increase. We've had an increase in our numbers. Just in general, there have been an increase in numbers. When we talked last a few weeks ago, so I think they're starting to maybe plateau a little bit, and hopefully will start coming back down. But we are in terms of the state metrics, we are back in yellow as opposed to blue because we topped 100 cases per 100,000. So there is an increase. We are seeing cases among all age groups, but certainly those 18 to 30-year-old is probably the bulk of the cases that we're seeing. And that doesn't mean that all those people are associated with a house or the university for that matter, but that's just sort of the age range that seems to be popping more often.
Yeah, I don't have any problem with the regulation as it's written. I think is really well written. And I really think that outdoor activities are clearly much safer than indoor activities. And I don't have a real problem with this as long as we keep an eye on how things are going. And if it looks like the cases are continuing to pop up and it's getting higher, that we can back off on it.
Yes, and that is one reason we wanted to make sure that we specified that yellow status as well, not just the red. And we continue to meet regularly to go over what's happening as well.
And I have a question for Leslie, which is just a little bit off this topic. Does the university require meningitis B or MMR inoculations of students, vaccinations before they can attend the university, or other kinds of immunizations?
You know, I will have to, I'll have to reach out to Dr. Roop, the director of our health center. She's the medical director, to get that information for you. So, but I can get that and then follow up.
Yeah.
Because if there is that practice and if there are exemptions, then there's a system in place for this kind of thing, which we're debating. And I just wondered whether it existed.
Yeah,
Thank
We
you.
had, didn't they require a flu vaccine this year, Leslie?
Yeah, we have an immunization clinic in our health center, and we do have vaccine requirements. And so we do have a system set up at the university for that for students.
And I will add to that, that I know that has changed a little bit over the years too, because for several years back, there was that requirement, but you could sort of say I had it. So things have been tightened up, and that's been since we had, you know, what measles or mumps outbreaks that we've had to deal with that have changed some of those requirements in terms of how you show that documentation.
I was able to pull it up quickly on our website. It's on the health center's website, our immunization requirements, what we currently require. I put it in the chat.
Leslie, do you believe that the logging requirement for guests for gatherings is that going to be something that is going to have? Is that straightforward enough? Is the language that Penny read, is that going to give the houses enough detail? And do you believe that that will be acceptable? Like, will that be reasonably done by the houses? Is logging guests? And I mean, there's a public health rationale behind it for, you know, contact tracing and things like that. But do you think that that's administratable by the houses?
I think so. I think they just need to work on developing a system. And so if that's guests need to check in and, you know, when they are on the property and when they check out, when they leave the property, I think if the house can create a Google spreadsheet or an easy way to do that, then I do think it's feasible. And so I think that we could actually probably share that. Once we have the regulations, we can share those with our COVID coordinators and then maybe provide guidance and tips of how to consider that. If you want to sharpen the language, I think you certainly can. But that's something that we could probably talk with the students of how to make it easier for them to be able to do that. And then to set the clear expectations and accountability for their members to follow those guidelines.
Leslie, don't they have to document any other visitors right now anyway?
Yes, and in some groups, some houses do that probably more regularly, and some probably do it anyway, have guests log in and out during non-COVID times. I think what will be challenging is the guests outside, and so they'll have to do that virtually or on a phone or like a Google spreadsheet or come up with a way that they can do that virtually, probably to make it easy to do it. Or yeah, some might do that. Hand sanitizer, Clorox, clean off the pens.
Yeah, that was sort of my question, was the outside environment. And you can imagine, you know, people coming and going and, you know, somebody having an eye on not exceeding 15, but not really being that scrupulous about documenting who exactly it is. So that has to be something that they, you know, that's their burden to figure out how to track that, I guess.
Well, and then I would say, you know, if there is a positive case or if there are complaints, then a part of the process could be to request the guest list. And so the expectations around that, I think, could be explicit. So I don't know if that's included in what you've considered for the regulation, but you could say that it must be submitted upon request. And so at any point in time that could be requested. That might help with accountability or tracking.
Okay, any other questions for Leslie or anyone?
I was just going to answer Dr. Chalukian's question a little bit earlier in terms of what we've seen. I think in terms of data, in terms of positive cases, it's just kind of trickling where houses tend to have maybe one, they move into yellow status. I think they're doing a much better job, likely because you know, we are all more knowledgeable and we've done more training too. I think they've done a much better job of quickly isolating students who've tested positive and then quarantining close contacts. And so thankfully, we've only seen maybe one positive, move them into yellow status, potentially two. And so we've had a few houses quarantined. We currently have 2 under that status at this time, but it's been much smaller and trickling as opposed to in the fall when there was a quick spike and a quick increase in positivity rates that were somewhat unmanageable at one point in early September.
I can make a motion that we accept the language of the regulation as we're discussing with no changes.
Thank you, Carol. We have a motion. Does anybody want a second?
I would provide that second.
We have a motion and a second. Let's vote. George?
Yes.
Mark?
Aye.
Steve? Steve?
Unmute, Steve.
You're muted.
Sorry. Still yes.
Carol?
Yes.
Bob?
Yes.
And I vote yes. So the motion carries.
Thank you very much. That is all the changes that we had to recommend on the regulations for residential and communal facilities.
And we really appreciate all the work you and Margie and everyone has put into helping us with that language. We appreciate it.
Yeah, we had a group conversation and it did take longer than, maybe others wanted, but I think we came up with good language.
Margie is very much appreciated, by the way.
Very much.
Thank you. It's my pleasure to help. And I will say that getting this language right was important, I think, because we really wanted to try to accommodate the students' request. You remember there were some students at your last meeting requesting for the ability to have guests on their lawn. And so we were trying to accommodate that request as well as meet the board's professional concerns. So, and I want to thank IU for helping us get that language right.
Okay, any new business?
We have the other regulation to go over.
Oh, we do, don't we?
Yep. And this should be fairly simple to, I think, as we've talked about before, our numbers, our advisory, numbers are kind of going back up. We feel that it is premature, as you all talked about last time, premature to take away the mask requirement for the county, the distancing, and feel that the bulk of these regulations should remain in effect. So the things that we are kind of proposing first would be the effective date would be April 7th at noon. That's quick, but we don't really have anything in here that should create any big changes for anybody. That certainly nothing more restrictive than what we have. These orders would remain in effect through May 28th unless rescinded or extended before May 28th. And part of that is, in the very beginning with these orders, we put in some end dates. And then when we did the mask requirement in July, we didn't have one. And there was a lot of pushback on that, but I think it was the right decision because here we are, a year later, we're still in a place where we need to keep the mask requirement. But we do feel like there's sort of that light at the end of the tunnel, and it is worthwhile letting people know that we hope, and our goal is that, by the end of May, we may not need all of these regulations. And so we would come back before then and revisit whether or not they can be rescinded early or whether you need to extend a portion of them or something like that. But I feel like this having a date in here for an sort of an end date does give people the goal that they understand that we have a goal to not stay in this state of restrictions forever. So that would be, it doesn't mean that they can't be extended or that they can't be rescinded early for that matter. It just gives people a date, something to look forward to perhaps.
Yeah. I think it's good to, I think what I've seen anecdotally again is that I think that the governor's announcement that they're going to get rid of the mask requirement has given people more boldness. I've seen a lot more people without masks inside, not just outside, but inside. And that bothers me a whole lot. And I agree with you in terms of the end date. It's nice to have something to think about. But I've talked to way too many people who have taken getting the COVID vaccine as a get out of jail free card. And it's unrealistic. 90% is not 100%. And it's only it's 95%. The most recent data I've seen is it's 90% effective in preventing disease. And that's personally not enough for me. It's bad disease. And so I just feel that we should stay where we're doing, because we are seeing a bump up. It was plateauing for a while, but now we're going back up. So it's certainly not time to go backwards. And the reason we've done so well is because of the regulations.
Right. And that people are getting vaccinated, but a 15, 18% vaccination rate is not that 75, 85, 90% or higher vaccination rate that we're going for. But again, hopefully there is a big push this month and in May to really get vaccine out there and increase the number of people who are vaccinated, especially in the state. So hopefully we will be in a better place. And if you're meeting every few weeks. If you meet early May, you have the opportunity to look at where things are and kind of see where you think you might be. The other piece of this, again, we can continue face covering requirement. We continue with those exemptions that we have. There is one section in dealing with our schools, and the schools we have the whole time have academic and extracurricular activities in K through 12 should follow CDC guidelines, Indiana Department of Health guidelines. And we have just added, and in consultation with the Monroe County Health Department, that those, that they can kind of work on what is, and I just realized that I've got I've skipped a page somehow, somewhere, but in conjunction with the health department. So that's just an add on there. And our gathering size limit would remain the same. There's not really a change there. It would hold true, that 50-person limit would hold true. And again, I think that that's prudent with us being back in that state advisory of yellow. I think if we come, if we see that downward trend, then maybe, we can address that in May. The one thing that is probably a bigger change you may want to discuss, but in terms of restaurants, retail food establishments, bars, we had the party size limit is limited to 10 people or fewer at each table. Back-to-back seating with plexiglass barriers will not replace the necessity of 6-foot distancing rule. And that was in place really because of the state. And that was part of one of the executive orders. It was part of the guidance from the state health department at that time. But we use barriers for other reasons. We use them in office spaces and other places. So we would like you to consider saying that they may replace, that they may use that. So they're back-to-back seating in booths, for example, if they have a low-level plexiglass barrier of some sort, they may be able to use back-to-back seating. So that is really, I would say, the big change here. The other, again, there's no bar top service at this time, and they continue to close at 2 a.m. So it is really the date of giving them an end date. It is adding the in consultation with the Monroe County Health Department for schools K through 12, and then considering allowing booths to be back-to-back seating if they have an additional plexiglass barrier between those booths.
But no buffet service.
Correct. We, as in yellow, we would still, they're not allowed to have buffet unless they're serving it. And that stays the same.
Interestingly, one buffet just in the county south of us, they typically have a buffet, but now what they have is you can order, but you can refill anything unlimited amounts. So they can order a steak and have a second steak, but it's all about ordering. That's how they've gotten around their buffet style presentation prior to COVID. FYI.
I think that would be an economic challenge if it was several steaks.
Exactly. Well, that's what they did on the in their, when you're at a buffet, you can go back and have as much of whatever you want.
Sounds like Golden Corral.
Nice guess.
Board members, discuss anything about?
Shut up.
Are you okay with that? Okay, do I hear any motions?
I'll move to accept those modified regulations as stated by Penny.
We have a motion, we have a second. We have a second, okay. Let's vote. George?
Yes.
Mark?
Aye.
Steve?
Yes.
Carol?
Yes.
Bob?
Yes.
And I vote yes, so the motion carries. We'll adopt those new regulations, or those new as written.
Thank you.
This is written. Okay, anything under new business, Penny? Do you have any new business?
I think the only new business would be your next meeting.
Okay. Board members have any new business? Okay, let's look at our calendar.
How soon do you want to do it? You want a whole month, or what do you think we need, Penny?
Well, I was looking earlier, you could consider May 4th. That would be 4 weeks. And it would be essentially 4 weeks before these were set to change. So it would give us time to look at them, for you to talk about whether or not you thought they might, what things were looking like, how you felt about them.
Mm-hmm.
May 4th works for me.
I can do that.
I'm on board with the 4th.
Should we
What time?
start a little bit later, as Dr. Sharp suggested, so maybe people could finish their work day before at 4:30?
4:30 works.
Okay with me.
Works for me.
4:30, okay. All right.
Works for me.
Our next board meeting then will be on May 4th at 4:30.
Excellent. Thank you.
I have a 7 o'clock meeting on Tuesday, so I want to make sure I get there in time for that, but 4:30 is okay.
We both have a 7 o'clock meeting.
Very good. I think that, we can look at these very quickly, look at where the numbers are. And certainly if you have thoughts or directions that you want to give, share those with me, and we can share those, or just let Dr. Sharp know directly, and we can have them ready and try to address them. And then the only other item that I really think that we'll have would just not be a deep discussion about the budget, but to kind of gather input on going forward, so we can talk more about that.
Archie, I want to make sure May 4th is okay with you.
Yep, that works for me.
Okay. And Penny, you're working on those job descriptions and so forth.
Yes, I have a meeting with PAC, which is a subcommittee of the council, and it is council that really handles our job descriptions, and they're in the process now of assessing all of our job descriptions. So we hope to have those to them officially no later than May, since the meeting for April was pushed back, was originally today at noon, and it was pushed back a little bit. We may be able to expand what we present to them, but planning to talk to them as a reminder that they had agreed to let us add these this year, if at all possible. So we're back in the building, we're getting situated. Now is a good time to finish those up and get those in.
Come over and see it. It's very nice.
And maybe in a couple months, yeah.
How's it being in the new building?
They won't let us in, but
Maybe later.
You have to wear a mask.
Do you need to sign it?
Okay, well, I think we've got our next meeting scheduled. So I thank everybody for being on board, and I'll see you at the next meeting.
Thanks. Have a nice evening.
thank you.
Thanks.
Thank you all.